Hello everyone. In the previous section we have seen about focal spot and now we'll learn what is filtration and how it works. So filtration basically is the process of shaping the X-ray beam so that the number of photons useful for imaging will be more compared to those photons which increase the patient dose or decrease the image contrast. So how it works is normally the diagnostic X-ray beam emitted from the tube have a whole spectrum of energies. That is, the energies of the photons are not uniform throughout the beam. And when these beam of radiation with different energy level photons pass through the patients, what happens is most of the lower energy photons in the X-ray beam are absorbed in the first few centimeters of the tissues and only the high energy photons will be penetrated through the patient to form a radiographic image. One important thing to note here is that the patient radiation dose depends on the number of absorbed photons. So, as the first few centimeters of tissues of the patient's body receive much more radiation than the rest of the body parts, as I have told previously, it can be prevented by absorbing the lower energy photons from the beam before they reach the patient. And this is done by interposing a filter between the patient and the X-ray tube so that low energy and high energy Bremsstrahlung radiation will be absorbed. Normally, in a diagnostic X-ray system, filtration occurs at three different levels. First is the inherent filtration that occurs with the X-ray tube and its housing. Next is added filtration that is done by interposing metal sheets, and last one that occurs as the beam passes through the patient. Next, we will see types of filtration. First is inherent filtration. So, inherent filtration occurs as a result of absorption of X-ray as they pass through the X-ray tube and its housing. And the materials that responsible for inherent filtration are the glass envelope enclosing the anode and cathode, the insulating oil surrounding the tube, and the tube window in the housing. And it is measured in aluminum equivalent, which represent the thickness of aluminum that would produce the same degree of attenuation as the material used. Inherent filtration varies between 0.5 and 1 mm aluminum equivalent, and the glass envelope is responsible for most of it. Next is added filtration. So the added filtration results from absorbers placed in path of the X-ray beam outside the window of the tube above the collimator. And as I said earlier, most of the low energy photons will be absorbed and high energy photons will be transmitted. Now we have the first question. What is the purpose of filtration? Next, we will see the total filtration in a diagnostic X-ray system. So the total filtration will be the sum of inherent filtration and added filtration. Here, the table shows the total filtration that is required according to the National Council for Radiological Protection guidelines. So according to this, if the machine is operating below 50 kUp, a total of 0.5 mm aluminum equivalent thickness is required. And if the machine is working at a 50 to 70 kVp, a total of 1.5 mm aluminum equivalent is required. And if the machine is working above 70 kVp, a total of 2.5 mm aluminum equivalent is required. So we have learned about filtration. Now we'll see about heavy metal filters that are used in mammographic equipment. Heavy metal filters are also known as K-edge filters as they make use of K-absorption edge of elements, that is, sudden increase in X-ray absorption that occurs when the energy of the X-ray is just above the binding energy of the innermost K shell. So these filters are used to produce X-ray beam that has a high number of photons in specific energy range that will be most useful for diagnostic mammography. So here the maximum contrast is obtained when the photon energy of the X-ray beam is slightly above the K absorption edge of the filter. Here in this image we can see the use of molybdenum for producing X-rays. So here the binding energy of the K shell of molybdenum is 20 keV. As a result, the resultant radiation produced will have an energy range between 7.5 keV to 19.6 keV. In mammography, we mainly make use of molybdenum and rhodium filters. So the molybdenum filters that is having a thickness of 0.03 mm is used in molybdenum and rhodium target X-ray tubes. These filters attenuate X-rays above 20 keV and allows X-rays of 17 to 20 keV to pass through it. That is required for imaging an average breast size. Now here in this graph, a molybdenum target with molybdenum filter is used. In this graph, we can see the target produces characteristic radiation of 17.6 keV and 19.7 keV. That is shown in orange color. Now we have to remove the radiation with energy above 20 keV. So a molybdenum filter that is having a K absorption energy of 20 keV is used. Next, we have rhodium filters that is mainly used in rhodium and molybdenum target X-ray tubes in mammographic equipment. Rhodium filters attenuate X-rays depending on K's absorption of rhodium and allows X-ray energy level of 20 to 23 keV to pass through it. It is mainly used for large or dense breast size. In this graph shown here, we used molybdenum target and rhodium filter. In this graph, we can see the target producing characteristic radiation at 17 keV and 19.7 keV, which is shown in orange color. Now a rhodium filter is used that has a K's absorption of 23 keV so that more radiation produced by the molybdenum target will be transmitted through the filter when compared to the molybdenum filters used. Next, we will see about rhodium-rhodium filter target combination. Rhodium, as I have mentioned previously, it allows X-ray energy level of 20 to 23 keV to pass through it, and it is mainly used for imaging large or dense breast size. Here, in this graph, we can see rhodium target with rhodium filter combination. The graph shows that the target produces a characteristic radiation at a level of 20.3 keV and 22.7 keV and is denoted in orange color. Now we have to remove photons with energy above 23 keV. So a rhodium filter is used for this purpose. Next we will see about rhodium molybdenum filter target combination, which is not currently used in diagnostic mammography. So in this graph we can see here the rhodium target produces a characteristic radiation of 20.3 keV and 22.7 keV. So if a molybdenum filter is used for filtering the characteristic radiation produced by the rhodium target, what will happen is there is a chance that it attenuates some of the useful characteristic radiation from the beam. So it is not currently used for imaging. Question number 2 for this topic is, what are the filters used in mammographic equipment?